Today is 22nd August 2019. Day 2 of inpatient. This is the 14 years old male neuter Cocker Spaniel. Came yesterday with the problem of a bit swelling around the neck area below the chin.
Was it left side or right side?
It's a right side.
Sure. Right and left. I thought it was left side. The left side or right side? Left.
Yeah. Just
Okay, where's your pointer? Okay, so what happened was this dog suddenly had a big swelling, according to the owner, on the, should be left side of the neck, on Sunday, which is about 4 days ago. Went to emergency vet clinic at night, and the vet there made a cut on the swelling, a small cut, show the cut about 1 centimeter from there to there, 1 centimeter, and sent the dog home with sodium, a bottle of saline, and oral antibiotics. So the dog was home for 3 days, but didn't recover. It was recumbent. Recumbent means lying down, and not show now the dog is at least able to lift up the head. Lift up the head. And so the owner brought the dog here yesterday. So we put the dog in as inpatient, and that time we see the blood test results.
the dog
Shows
has the fever.
fever 45 degrees, and you see the blood test result. Put down blood test result, and you can show that it was really bad leukocytosis. How many? 151.
151. Normal range is 6 to 17.
6 to 17 years. So that means it is really about 7 times the total number of white blood cells inside the increase. So that shows a bacterial infection.
And then
The neutrophilia.
Here 97.8, 98.7.
This shows that most of the white blood cells are actually neutrophils. Now neutrophilia, the normal one is not 98.7% but 60 to 70%, and you can see that the dog really had a very severe bacterial infection, because neutrophils are produced to fight bacteria. Normally 60 to 70% in a normal bloodstream in a normal dog, but now it's 98.7. Now look at the absolute, show the absolute 149.
149.04.
The absolute number is 149.04
times 10.
times 10 to the power of 9 per liter. Now the normal one is 3 to 11.5. Even if you take 11.5, you take 12. So the numbers is 12 times higher at 149. And the platelets, look at the platelets.
Platelets is 362. Normal range is 200 to 500.
Platelets is okay. So
Hemoglobin is low.
so from this total white cell count increase, we know this dog has very severe bacterial infection, and that's why the fever was 45 degrees.
40.5.
40.5. Then now we look at the red cell count and the hemoglobin. Just point at the hemoglobin. How many is it?
Hemoglobin is 9.7. Normal range should be 12 to 18.
Yes.
Red cell count is 4.4. Normal range should be 5.5 to 8.5.
So it's low. Okay, so the dog also has anemia. Okay, now we look at the gums. After treatment yesterday, you can see the dog really had a bad teeth here. The owner said that there was some dental done last year, but I don't know whether it was done or not. And check the eyelids. This is after giving drips, and
Stay pale.
still a bit anemic. Don't expect recovery so far. So we are giving iron, vitamin B's, amino acids, B3 antibiotics, IV. IV. This is the second bottle. Is this second bottle?
Yeah. Now we are giving the amino acids.
Amino acids. These are proteins, and we did give anti-fever, spasmogesic.
Now the fever,
IV,
the body temperature is normal.
Today the dog has no fever and is actually able to sit on, lift up the head just now, as you saw just now, but still very weak. We bathed the dog and open up the wound as well there, so it's not so smelly. We open up the incision.
They open and the incision quite
So
big.
any more discharge now?
Yes, they have
You can see the discharge here. So actually the abscess was very big, up to where? Up to below the chest there, the sternum.
about 7
I think
10 centimeter.
the first vet should have done is to have a bigger incision and drain up all the pus instead of sending the dog home and let the owner do it. Of course, the owner didn't do it, and it's a miracle that the dog is still alive. But we don't know really what happened there. Maybe the owner didn't want the dog to be inpatient there. We don't know. So what we know is that the dog really had very foul smelling pus coming up from the wound there, and was really lying flat down, not like this. It was just on the side, lying recumbent, we call it, no? And lethargic. Did he eat?
Yeah, he finished 1 can of 80.
Okay, so the dog did eat overnight. This is the day 2 of inpatient, and the spasmogesic will bring down the fever, and the spasmogesic has some painkiller effect also, so that will help the dog. And so we'll continue with the drips and the amino acids for another day.